Hi, I'm Don Mooers, and welcome to Montgomery Week in Review. The consequences of global warming in the most northern and southern latitudes have caused concern across the globe, including in our fair state. Dr. Bruce Fowler, President's Professor of Biomedical Sciences at the University of Alaska in Fairbanks, is here to explain. Thousands of people participated in the annual Monarch Butterfly Watch to document the swarm's trips from Mexico to Canada. Dr. Barry Thompson, who among other things has been a great beekeeper, but a scientist, a talented individual. He joined the watch. He's here to tell us why the information gathered may help in the assessment of the health of all pollinators. The S Word, a documentary about suicide, has been sponsored by Every Mind and other organizations throughout Montgomery County to enlighten the community and to provide some answers on ways to help people who are contemplating this terrible end. Jennifer Grinnell from Every Mind is here to explain how we can see this movie. The state's attorney's office has had a mediation program for various criminal cases for the past 30 years. Melissa Henderson, coordinator of the program, has a story about how it started, its operation, and what it does. Welcome.
Glad to be here.
So tell us, I've known you for some years. We're Fulbrighters, you're on the National Fulbright Board, just incredibly talented, so many things. Fairbanks, Alaska?
Yes, Fairbanks.
So how did you get hooked up there? And then we get into about global warming and all that.
My wife did it.
Well, good for her.
Yeah. No, she got appointed for a time at the University of Alaska, Fairbanks. She's an epidemiologist working on nutritional aspects of things.
Okay.
And then one day she said, "Why don't you come with me?" So I did, being the good husband that I am. And the folks running the center said, we have concerns about toxic chemicals also, and we wonder if you would be willing to participate.
That's great. So then coming from that hook with Fairbanks, tell us a little bit about what you're observing and what some of the issues are, and again, also how it affects us.
Well, it affects all of us, actually. The global warming, it's well documented now that our planet is warming.
Sure.
But it's not uniformly distributed. Some areas of the planet are more impacted than others, and the northern and southern climes are among these. Alaska is one of these. Now, this has consequences in terms of people, and in particular the native health research people.
Okay.
There are, I think it's like 57 different tribes of Eskimos and Indians. Right. And many of these people are subsistence hunters and fishers. And if you watch television programs on this area, you'll see them hunting and fishing.
Right.
And they'll say it's their tradition. Well, it is that, but it is also what they have to eat.
Right.
You can starve to death very easily in these northern areas if you don't do that. So the global warming is having an impact in several ways on the livestock,
okay,
we'll call it.
Right.
And there are changes going on, particularly the one I'm most fascinated by are the bears.
Okay.
Okay, there are polar bears and there are grizzly bears. They now have a third species called gruller bears or pizzly bears.
Okay.
And they're basically a mutation, not a mutation, but a crossbreed.
Okay.
And it turns out the polar bears and the grizzly bears had an ancestor 15,000 years ago, a common ancestor, but they were separated by habitat.
Okay.
And so now, but they can breed. They can come together and be fertile. So this is one thing that's happening.
Okay, well, let's hold on there. I think they've got some questions about what you...
I was curious about the populations, if with global warming and if this is their livelihood, where will they go? Do they stay there or what will happen?
That's a problem. These folks live typically in relatively small villages, 500, 700 people. And you have to understand how huge Alaska is. It's 40% of the landmass of the lower 48, and there are only 700,000 people who live there or so. And so they're long distances apart. You don't run down to the corner grocery store. So that gets into the issues of human isolation, and particularly in the dark months.
Which gets to every mind.
Yeah.
Yes, and their mental
Alaska.
wellness, I'm sure.
And seasonal affective disorder. We
Sure.
should talk about that. This is a problem, both in terms of how they cope with these changes, but also the fact that the things that they've had to eat in the past are changing.
Yeah.
Well, how do you approach this problem? What are the first steps? It's obviously a long-term solution.
It's not easy, actually, because these folks are used to being self-reliant and living in their villages. They're comfortable there, I'll say it like that.
Right.
And in the past, when people have tried to move them into, or they've moved into larger urban areas, it doesn't work.
It
Right.
hasn't been
They go back.
successful. Yeah.
Right.
Okay, they're just uncomfortable.
Right.
And the remarkable thing about living in these really rural areas is that when it's quiet there, it's really quiet.
But if you choose to live in one of these areas, and you are a hunter, fisher, subsistence lifestyle, what can be done to improve the environmental situation such that hunting and fishing is permissible?
Or do they have to be nomadic and move?
Right.
Right.
Well, in fact, the
Response.
Yupik Eskimos down on the Yukon, Quashquohima River is where it's
We've
called.
got about a minute left.
Okay, which goes into the Bering Sea.
Right.
And these are fishers mostly. They've had to move 3 of their villages to higher ground because of the sea level rise.
Okay.
That area, Alaska in general, outside of the mountains, is relatively flat. It's grassland. And I want to say something about the tundra. Tundra is frozen bog.
Right.
And that's where we get into the mosquitoes.
Can you go back to the bears? We have 20 seconds. Seeing all this research that if you take away the highest person or highest group on the food chain, affect them, that has such a debilitating impact on everything else. Is that what's going on with the bears?
Everything's
10
connected to
seconds.
everything else, yes. And so this disrupts the entire system. And so then the bears, being bears, start looking for other things to eat, which includes people.
And we got to stop, and that puts them right in the face of lots of problems.
Yes, it does.
All right. Well, listen. Look forward to having you come back, Bruce, Dr. Fowler. It's great to have you, and look forward to joining you and supporting the Fulbright program.
Great. Thank you.
Barry, how are you?
I'm fine.
Wonderful to see you.
Good to be here.
You know, it's interesting. You've got such a fascinating career, and you've done so many amazing things in your life. And with this show, you're typecast as a beekeeper,
Right.
because it's so fascinating to our producer, it's so fascinating to all of us, and you have helped probably do more than anyone else in this county has ever done in helping us to understand the connection between these unbelievable pollinators, the most important pollinators, and our food, and our very essence of life. That we can complain all we want about bees going around, but we can't hug actually a bee, but we ought to hug a bee if we could, because of its importance to all of us.
Well, and education is key. I spoke to a clerk at the checkout counter at one of our local grocery stores the other day. She's worked for the store for 19 years and didn't know that pollinators pollinate vegetables. Amazing.
At least you didn't think they grow in the refrigerated
In the
sections,
bins.
which some of the people.
You know.
We're talking about monarch butterflies. Tell us about.
Well, first
what's
let's
going
talk about pollinators in general.
on. Okay.
Bats, bees, beetles, birds, butterflies, and some small mammals, particularly in South America. But today we're talking about the iconic monarch butterfly, which most people would recognize and see as a key insect indicator of the health of the country.
Right.
University of Kansas put together a program several years ago called Monarch Watch, which is perfect for citizen scientists who want to participate. There are 2 sessions in which monarchs are noted in your yard on a daily basis, and then those reports are aggregated to suggest that the eastern flyaway, which is the eastern United States, or the western, which is usually terminates in California,
Okay.
are populated to the same degree. Monarchs are down 90% over the high of several years ago.
Horrible.
Combination of things, environment, but mainly loss of habitat, particularly the pollination-friendly plants on roadsides and so forth and in farms.
With the mowing down and everything. Right. Okay.
And the fact that illegal logging continues to occur in the Michoacan area of Mexico, where they overwinter, and the conifer trees on which they're dependent are being logged.
I was just curious in terms of Montgomery County, what residents could do to support the monarch butterflies.
Well, the obvious thing is that you can participate in the monarch count, which allows one to help aggregate the data that tell us about the health of the insect. At the same time, as with any pollinators, it's pollinator gardens, it's pollinator-friendly plants, both for pollen and for nectar. Monarchs are particularly fond of milkweed. It's the only plant on which the larva will grow from egg to adult. And at the same time, they get nectar from a variety of different milkweeds. They also inhabit the garden and the flower areas to provide pollination primarily for ornamentals in our area.
I think milkweed is also, I'm a gardener, and I think it's quite beautiful. I'm not certain about that, but I think I have some milkweed, some purple milkweed.
There are 5 or 6 different varieties in this part of the world, most of which are attractive. Now, the ones on the roadside oftentimes are the ones that are key, and they get mowed down in many instances. However, the Department of Transportation in Maryland is one of the state agencies that has been a leader in protecting pollinator-friendly plants in the, roadside.
But not enough.
Important.
Never enough.
It's in
sections.
Got to keep on.
Got to keep on. So, where do you see this going? I mean, you say that you can participate in the count.
Right.
How do people do the count? Tell us about what you did as part of this process.
Well, the count is important, as is obvious.
When did you start? What's the dates for the count?
Let's put it this way: the spring count was 2 months ago.
Right.
The current count started this week, and people can still join that count by going to monarchwatch.org and enrolling as a citizen scientist. You don't have to have any real skills. And if you have a question about whether or not you're counting monarch butterflies or not, you can either go online and compare, or they have experts that will come online with you and check you out.
40 seconds left.
I just have to say, I love the term citizen scientist. I'm taking this back home with me. This is
Absolutely.
great. Yeah.
Point being, you don't have to have a degree in science.
But
you have to be interested, and that's all.
Curious.
Right.
Yeah.
And the counts provide the opportunity to reinforce the good things that the Department of Transportation might be doing, or USDA might be doing, or the State Department is doing in its relationships with Mexico.
And getting people, when they see it and they understand how bad it is, getting invigorated and wanting to participate to protect this species and all other species around pollinators.
Did not count a single monarch last year in my home.
On that depressing note, we got a break for messages. We'll be right back after these important messages. And we're back. Jennifer, welcome back.
Thank you.
The S word. And it's something, again, with Every Mind, welcome. It's what a great organization. And as we try to continue our efforts to take away stigma when talking about mental health issues, and we can't get to effectively addressing the S word without reducing or removing that stigma. Tell us about the S word.
We do. Well, thank you for having me. It's nice to be back. So on July 11th, which was last week, Every Mind partnered with some local hospitals, also with our police department. They've got a social worker on their team, as well as the behavioral health services from Montgomery County came together to show the S word, which S standing for suicide. So it is a documentary that was done, and there are suicide survivors that are in the film really talking about their experience with the two really very public deaths of Kate Spade and Anthony Bourdain.
Sure.
The hospitals, along with Every Mind as a mental wellness agency, start figuring out how do we let people talk about it. The biggest problem is not talking about it.
I think Robin Williams, I mean, on and on.
Robin, yes, absolutely.
So I guess that answers the question I wanted to ask is why now? And do we see, what tell us about the S word, tell us about the documentary and why we should all see it.
So really, everyone should see it. I think one of the biggest myths that we have is that if we talk about suicide or if we're worried about somebody taking their own life, we worry about actually saying the word, because we worry that someone will then think about it as if they didn't have the thought, which is one of the biggest myths. The number one thing we can do for anyone is ask them and be ready for their answer. And this was really one of the reasons. I mean, there's so many other things, you're right, with Robin Williams, and you know, people are taking their lives every day. We need to talk about it more. We need to lessen the stigma and recognize that there are a lot of places that can help.
And you make such an important point. It's not that mentioning suicide induces the thought.
Right.
The thought's already there.
It's already there.
The thought's there for so many members of the population.
It is.
That's right.
And having the word brought out is not going to change that,
No.
but it allows us to address it.
It allows us just that little tiny window to open it up
Right.
and say, what's going on? What can I do to help? What have you really thought about?
Could I go back to Alaska? This is
Yeah.
a problem up there
It's
because
huge.
of seasonal affective
Yeah.
disorder, among other things,
Yeah.
and isolation. That these folks living in these small villages don't have access to
No.
clinics and other things.
You're right, and even more and more research is coming out, and it's not going to a surprise to anybody that loneliness and isolation are huge predictors of mental health issues and our own mental wellness.
And the irony is that as we become more connected on the internet, people are becoming more and more isolated.
Yeah, yeah.
Not having interactions
Yeah.
with human beings except
Yeah.
through their instruments.
There's pros and cons to social media in general. There's a very isolating effect to social media in terms of not really engaging and looking up and making that eye contact. And there are positive aspects to social media in terms of finding other people who have the same interests as you, or you know, that stuff. So
Jennifer, I read, I'm pretty sure I've read that if you do bring up suicide to someone and ask someone, have you thought about killing yourself? If they say yes, you're supposed to ask them then, have you thought about how you do that?
yeah, what is the plan? That is absolutely correct. So the goal would be when you ask somebody, hopefully you're in somewhat of a private space and you're ready for their answer. If they did say yes, then your next question would be, have you thought about how you might take your own life? And then if their answer is that they have a specific plan, the next would then be to get some help and to get some resources, whether that's contacting the Montgomery County Hotline, the National Lifeline, or even just, you know, reaching out to somebody else to figure out, what do we do now? You're absolutely right, because not everyone who's thought about suicide actually has a plan.
Right, right.
Yeah.
And I just wanted to comment in a grief group that I'm in. People have raised the fact that if they have a close family member or a close friend that has killed themselves, that they're not comfortable talking about it because they don't get the same kind of response as someone who's lost somebody else from another kind of another
It's
kind of
again, it
death.
goes so much back to that stigma, right? That you've
Right,
lost someone by suicide versus a car crash or somebody who had a terminal illness. We don't get that same, there's just still so much shame around, I mean, the S word is suicide, but there's still so much shame and stigma around
In my
it.
profession, I'm going to turn, we've got about 30 seconds.
Yeah.
There's a very high prevalence of suicide among attorneys.
Yeah.
And it's, I don't, you know, alcoholism and other things. Is there a reason why certain professions or certain individuals, and we heard about SAD, about 15 seconds.
Yeah, I would
That's
imagine
unfair to
there's
that,
some
too.
data behind that, but I would imagine some of that is pressure. And, you know, look, using Kate Spade, I think one of the articles that I had read about her was that she was embarrassed to talk about that she was having these thoughts considering her position and the work that she did. And I would imagine it might be similar for
Most
attorneys.
important message here is go watch the S Word
Watch the S Word. We will have more screenings about it, and ask somebody.
and check
talk
in the
about
Every
it.
Mind
Yeah.
website for more information.
Absolutely. Yeah.
Thank you very much.
Thank you.
Mediation. State's attorney, welcome on your first time here, Melissa. It's hope we haven't overwhelmed you. You've done a great job so far.
Thank you. It's very nice to be here.
Tell us a little bit about what
Yes.
you do and about this program that I don't think a lot of people know about.
So the program has been around a long time. We mediate criminal cases, typically things like second-degree assault, destruction of property, theft, those kinds of things, bad checks. And basically mediation gives an opportunity for the person that brings the complaint and the respondent, sometimes called the defendant, to sit down with a neutral person and talk about what happened, which really often does not happen if you go to court. A lot of people think they go to court and they're going to get a chance to talk about how they were wronged or what happened. And what happens most of the time when people go to court is the attorneys do most of the talking, and the parties themselves don't really get to talk too much.
What a great idea, because it seems to me that a lot of times it's out of the heat of the moment, or someone doesn't understand the circumstances that another person is in, and by bringing together, what kind of results do we see?
Well, it's very successful. I mean, you know, it's well over 80% of these cases that come to mediation result in agreements. And the thing that I think that's particularly helpful is cases where people have a previous relationship. So we do get cases where family members are filing against another member for assault or for something that was broken. And the mediator is able to help them listen to each other, to gain for them to gain perspective of the other person. And so there's a lot of benefits to it for actually both the complainant and for the defendant.
I'm curious, can you choose to go through mediation, or are there certain levels where you can't go through mediation?
Well, in our program, we don't do divorce or custody or parenting issues.
Because those are all civil.
Correct.
Okay.
And we also don't mediate any kind of domestic violence cases.
Okay.
You know, the idea behind that is people are really not in equal footing, so we
Right.
wouldn't mediate cases like that. The community could call me and contact me, and if there was some criminal element to what their concern was, we could potentially mediate that. Most of the referrals that we get are internal referrals from our district court screening team.
And do they refer because they feel like this could be potentially mediated without going to the court?
Correct. These
Okay.
are kind of lesser crimes.
Okay.
And so and the truth is that some of these cases that we get are cases that might not actually go to trial. There may not be enough evidence, or there may not be witnesses, or somebody has paid somebody money but there's no record of that.
But you
So
still have a positive result from the mediation at that point.
exactly. And so we do a lot of cases that to a large extent nobody else would handle, but it's, you know, the complainant ends up maybe getting money back. The defendant ends up resolving the conflict with no criminal record. So there's a lot of benefits to it. It is voluntary and it is confidential.
I've been impressed that this would save the county, it would seem to me, a lot of money. That without going through the court system, that in fact if you can sit down and get people to talk it out without engaging the formal procedures,
Absolutely.
this is a better way to live.
It is, and so it does save the courts lots of money. It also saves judges time in dealing with cases that maybe not are you know, as high level cases. And the truth is, a lot of judges don't want to they just plain don't even want to handle a case like this.
Yeah.
We had a car many years ago. A neighbor boy stole our car with an older boy, and mom worked in a car wash in town, and this kid was just in a bad situation. And it was through the juvenile system, but we really were able to work together, and the kid went and worked, and he paid off a bunch of the cost. But I felt like we were participating in what was a life-saving, in many ways, a life-saving.
As opposed to just going to court over it and you know, getting
going
some
in the
sentence
system,
and whatever that looks like.
Being put into a juvenile system.
Absolutely, and let me mention, we do have juvenile mediation in our program as well. The guardian or the parent needs to approve of the mediation in terms of it going forward. But
the mom just hugged us and said, "Oh my God, you know," and
I'm sure
we just were trying to make sure this kid went.
I think the cases that are the most
we have 20 seconds left.
The cases that feel the best are the ones where people have had previous relationships, family cases, cases where there's employer-employee.
You can really work it out.
Toughest kind.
You've done good. Nice job.
Thanks,
I want to thank all of you today for joining me. This has been a great
Don.
show. And I want to thank all of you in the viewing audience for joining us for this week's edition of Montgomery Week in Review. I'm Don Mooers, inviting you to join us next week at this very same time.